Symptoms or concerns about a child's brain health are very different than adolescence at times. Sometimes they're similar. But I'll go back to those kind of 4 periods that come before adolescence to look at that, because the behaviors of infants, before a child's able to be verbal, they do show us their feelings. And a child who is struggling with depression or anxiety, as you might imagine, they cry a lot more. They have more signs of distress, and they have more difficulty learning to self-regulate. And there's a lot that we can do with the dyad. By dyad, we mean not just the baby, but the parent, the mother, child. There was a pediatrician named Winnicott who said there's really no such thing as a baby. There's the baby-mother combination, because babies don't exist outside of having somebody who really takes care of their every need. So looking at the quality of the relationship and the interaction is really key in that early stage. And one of the therapies we can use is called parent-child or child-parent psychotherapy that looks at the relationship as much as the child. Now, in preschool years, kids can look depressed 1 minute and look just fine for sometimes a period of time. Then they go back into appearing sad, having more difficulty playing, maybe feeling more insecure. And there are children who are shy, they're naturally shy, and they kind of watch before they jump in. And that doesn't necessarily mean they're depressed at all. It just means that's kind of their constitution. But there's children who are normally very interactive, very engaging, and as they begin to pull away from that, we know that their neurochemistry, the chemicals in the brain that have to do with feeling and well-being, are being altered. And one of the interesting things when we do functional MRIs is whether a person gets psychotherapy or whether they get medication or whether they might get better on their own, you can see the difference in the brain chemistry and how the brain functions from when they're struggling to when they're healthy. So it doesn't really matter whether you get medication to get better or psychotherapy to get better, or what we find is what works best is actually using both together. But you'll see the brain get healthy when we do a scan. Now, school-age children, some of the indicators can be disengagement, not wanting to go to school, having difficulty interacting with peers, becoming more disruptive in the classroom. In a child who's not really struggled with behavioral problems, one of the early signs of depression or anxiety or even trauma can be that the child becomes more anxious, more angry, more disruptive, more likely to not follow the rules. Now, with the children who are kind of transitioning from childhood into adolescence, this is a time where it becomes especially difficult to tell what's kind of normal, healthy behavior and what isn't, because hormones begin to kick in. Kids can become quite moody as a natural part of their development, but they can also then get into some delicate situations where suddenly they're struggling and they're not doing well. Relationships can become really important. We see children in this age group and high school age where if they have a conflict with a peer, or maybe they're trying to date, or they imagine themselves to be dating, but then they feel rejection, that can trigger a really severe emotional response that sometimes, even though it may not be a persistent depression, it still can lead to self-injurious behavior or behaviors that are at risk for wanting to harm oneself.